Looming beneath the shadow of the COVID-19 pandemic, the opioid epidemic is resurging, and it's resurging in record numbers. The misuse of the addiction to opioids, including prescription pain medications, is really serious and actually is a national crisis. Dr. Richard Rauch and Sandy Founder both joining us this morning. It's great to have both of you here. Sandy, I know that you suffer from chronic pain, and we're going to get to your story in just a moment. But first, doctor, with a basic question, why is it so difficult to diagnose chronic pain in patients?
Great question, Heather. One of the problems is just that there's so much overlap in symptoms. So for instance, in your back, you may feel back pain, and that may come from a ruptured disc. It may come from a disc that's torn. It may come from something called a facet joint, where these joints cause pain when they deteriorate or degenerate. So the symptoms often overlap, but the actual etiology can be different. And so that's a problem.
So what are some of the non-drug therapies that you're able to offer patients now?
So that's so important for these patients because, as you said in your introduction, we are still in the middle of the opioid epidemic. And the pandemic, in an online survey, showed that 50% of chronic pain patients were having increased pain. Trouble getting access, just the stress of the pandemic itself. And this opioid epidemic's a problem. A similar survey of over 500 patients showed that 60% of patients did not even know there were non-pharmacologic treatments. We've got to do a better job of educating them that way. And over 90% of them, though, said, if I knew there was a drug treatment, I would love to have it. They're not all looking for just pills. So we do have some great non-pharmacologic tools in our toolbox as a chronic pain specialist. Sandy will talk about the spinal cord stimulation, which can be very helpful for these patients. We can position electrodes and arrays close to the spine. We can deliver energy to that and actually block the pain signaling from the periphery, from outside the body, so it doesn't reach the brain. We also can take a very specialized needle, and we can put energy through that and burn a nerve deep in the body that's producing the pain. So these are examples of excellent techniques, don't require drugs, very effective for diminishing or even eliminating pain in some of our chronic pain sufferers.
So Sandy, you had that procedure done. How big of an impact did that have on your daily life?
Oh, it was life-changing. So prior to the spinal cord stimulator, prior to my injury, I was very athletic. And then I had the back surgery and the pain for several years, and I couldn't do anything, and it was just awful, depression-wise, and just falling into different funks. And I got the spinal cord stimulator, and it was life-changing, like literally life-changing. I'm back to being able to do all the things I always could do and more. So I am currently kayaking, hiking, biking, running. I'm training right now for a 120-mile trek down the Florida Keys in November. So I'm training for that with biking and kayaking and some other activities.
Wow.
And I'm just thrilled. It's been a lifesaver for me.
It's so wonderful to hear. What advice would you have for people who are suffering from chronic pain right now?
I would strongly advise that they find a pain specialist that they can talk to about their condition and find out what there is for them other than just medications, because there is a lot out there, as Dr. Rauch said. And I went through a whole bunch of things before I ever found the spinal cord stimulator, and definitely visiting the website pain.com is wonderful. You can find out different pain management specialists near you that may be able to help.
Well, I bet you're changing at least one person's life right now. Doctor and Sandy, thanks so much for coming on this morning.
Thank you.
You're welcome. Thanks for having us, Heather.
You're watching The Morning Blood. We'll be right back.